In June 1992, an extraordinary meeting took place at a major university in Cambridge, Massachusetts, concerning the UFO abduction phenomenon. The Abduction Study Conference attracted mental health practitioners, UFO investigators, and abduction witnesses from throughout North America and around the world. Following the conference, a group of investigators and therapists gathered together for a provocative discussion of UFO abductions. The participants included Dr. Thomas E. Bullard, Assistant Professor of Folklore at Indiana University; John Carpenter, licensed clinical social worker and psychiatric therapist in Springfield, Missouri; Dr. David Gottlieb, a physician and therapist in Toronto, Canada; Richard Hall, a writer-editor, member of the National Board of the Fund for UFO Research, and author of a book on unidentified flying objects; Bud Hopkins, a New York City artist and UFO investigator and author of 2 books on UFO abductions; Dr. David Jacobs, Associate Professor of History at Temple University and author of a recently published book on UFO abductions; and Dr. David Prichard, a professor at the Massachusetts Institute of Technology and coordinator of the Abduction Study Conference. The discussion was moderated by Richard Hall.
What exactly is an abduction report? What is it that people typically report in an abduction case? Eddie, could you tell us?
The basic abduction report is an account of someone taken from the highway, from a bedroom, from the open air, taken into an unusual environment by usually very short gray beings of humanoid but non-human description, given a physical examination of some sort, and then returned home. Sometimes the cases get more elaborate as the person has a conversation with the beings. And in a few cases, you also get even more elaborate descriptions of transport to some very strange, seemingly otherworldly environment. But the basic, classic abduction report, in those reports, the key elements are the capture, the examination, and the return.
Okay, maybe Bud and Dave Jacobs could give us an example or two of a case they've been looking into.
Well, one of the things that should be mentioned is that this doesn't just happen necessarily one person at a time. And so if 2 or 3 people may be abducted, say from an automobile or whatever, when they're taken into the ship, I should add they're sometimes floated as if they're weightless, and very rarely do they simply walk. But when they're taken into the ship, they're generally then separated one from another, so they'll have very consonant memories up until the time they finally go into the ship. And I have cases involving as many as 7 people that were taken at once, but the description is exactly as you described it.
Okay.
I might add also that that the people who say these things are apparently a random cross-section of the population. And there doesn't seem to be any patterns that we can find in terms of age or ethnic group or educational level or anything of that sort. And they all describe basically the same experiences, and many of the reports are fairly complex. And yet, and there's of course a variation in detail in them, but of course there's also a certain precision in their detail that is very, very extraordinary and constitutes one of the core features of the abduction phenomenon.
Mm-hmm. Okay, let me ask.
May I just
Sure, pitch in.
What about the issue of what age are the people when these things happen, and whether they happen more than once?
The cutoff age for the first abduction is almost always about 30 or 35. Abductions seem to be an affliction of the young, sometimes starting at a very early age, almost at the cradle, certainly by age, say 5 or 6. And it usually goes on may go on the rest of your life, or a good part of it.
I think it's also important to realize that these cases in which a small child reports an abduction, sometimes in great detail, a child that I've worked with told his mother with great terror the next morning that he'd been floated out a window by 3 little beings. They went up a blue beam of light into a ship. He was put on a table. Things were done to his body. Some children then demonstrated to their parents where a cut was put on the body and so on. And these are children 2, 3, 4, 5 years old even. So we're not getting something that's feeding back through films or whatever.
Yeah, there is a remarkable lot of detail that keeps recurring from people who know nothing about the phenomenon, who know nothing about other people's cases, and as you said, even little children who have no possibility of remembering will still say the same thing.
Let me also say that at the same time, we do get quite a large number of reports from people who have had these experiences from the time that they were small children and who now might be in their 60s or 70s and are still having the experiences as well. And the experiences have a similarity basically with other people's experiences. In other words, there's a change in the way in which they might be handled from being a child to an adult. But all the cases seem to correlate according to age as well. All the adults basically say they're treated in one way and children are treated another way to a certain extent.
Okay, now we've just come from an important conference in which we've been addressing this subject. I'd like to ask Dave Prichard to tell us what exactly was the purpose of this conference. What did we hope to accomplish with it?
Well, of course, like any conference, you have a number of purposes and you try to balance them off. But I think first and foremost in a field like this, it's very important to bring the researchers and the abductees or experiencers, or whatever you want to call them, together. And in this case, we also brought in a lot of related professionals as well. It's important to bring them together just to talk and to share the ideas, and in the presentations to present the latest results in the field. A specific objective that differentiates this conference from many of the earlier meetings held at which abductees were a small or medium part of the proceedings, were that here they were the entire conference, almost 5 days, was focused just on abductions, no UFOs, no crop circles, and secondarily that we tried to bring in a wider group of professionals than is normally the case. We tried to bring in people, the psychologists, for instance, who are experts in ritual abuse or some sort of related collective mental aberrative phenomena, dissociative phenomena. We tried to bring in scientists and even theologians. I mean, this problem, I think when you really get into it, is extremely broad. It's not just a simple matter of being the table examined and put back. And certainly it has a tremendous effect on the experiencers. Of course, the third objective of the conference was to have a really good discussion, and at least the total amount of time allocated to discussion was about half of the presentation time. It wasn't just you make your presentation and then you dodge a couple questions and sit down. I mean, we really had a good discussion, by which I mean it was extensive and it was critical. And we had a number of critics, mostly of the methodology or of the interpretation. In fact, we even had a couple of people who were quite skeptical there. And then the final purpose of the conference is to put out a proceedings that reflect what went on and reflect this field pretty much from top to bottom, left to right, or however many dimensions you think it has.
Okay. We'll get a little later. We'll get into what we think we've accomplished here. But let me just ask the therapists: what were your expectations coming into the conference? What did you think or hope we would accomplish?
There were two things that I was hoping to take away from. One was to collect more clinical data and learn the results of clinical surveys that other people had done, which will help me in my diagnosis and my treatment. The other was to have a bunch of clinicians together and investigators and abductees representing a wide variety of experience, so we can begin to put together some basic guidelines on how to proceed from a therapeutic point of view.
Mm-hmm. John?
As therapists, we all work in such isolated fashion, far away from each other, so each time we have an opportunity to come together like this, it's like a family reunion of sorts, although there's always new members that we haven't seen before. Learn to pull them in and learn what their interests and expertise are. I personally learned a great deal from the specialists in other parts of the field, different aspects I had never encountered such expertise and knowledge regarding, and that was quite helpful to me and will continue to be an ongoing process. Mm-hmm. It's also quite helpful to hear from those who have experienced the phenomenon, and again, a representation from all across the country and to see what was similar among their experiences and especially needs.
I think if I can just add, one of the things that made this meeting really special for me was the wide diversity of specialists that were invited to speak and invited to participate, because one of my major concerns as a therapist is differential diagnosis. Someone may present believing they have an abduction experience, but I have to separate out the true abduction experiences from other things which may resemble it closely or may resemble it not at all. And we had people here who were expert in dissociative phenomena, somebody with ritual abuse, and psychologists, psychometricians, and so on. It was very helpful for me to try to hone in on the people that I should really be identifying as abductees.
Okay, good. Let me ask the investigators from their perspective what their expectations were coming into the conference, and you can go right ahead into what you think we've accomplished. We'll talk later about where we go from here, but so far, what you think we may have accomplished.
Well, from my point of view, I would think the most significant thing is pretty much what Dave Gottlieb said, that we got so many people and so many diverse points of view together. We got to see what people were doing in the field, how their different perspectives can make a contribution to our understanding of what's going on. And I think it was a very enlightening sort of thing to see not only the clinical side, but the investigative side, and all the variety of opinion.
And there was a lot of discussion about the interactions between and among investigators and therapists and the perceivers. That was a good part of the conference. Would anybody like to talk about that a little bit?
Well,
Go ahead.
actually, it's not exactly to that point.
All right, go ahead.
But the thing that was most valuable to me, I think, lies in the area of just the very things that Dave Gottlieb mentioned. I think, for instance, a woman who spoke about her specialty, which is treating post-traumatic stress disorder victims, what seemed to work better, what their strategies of denial, the various systems they use to handle experiences and so forth. Even though she is working with Vietnam War vets and other people, rape victims and so forth, the parallels were so extraordinary with what I run into practically daily with abductees. It was extremely helpful to get her perspective on treatment and behavior, symptoms and so forth. Because not being a trained therapist, of course, it's extremely important for me to get as much raw material as I can from these sources. And I think for the investigators, at least speaking for myself, all of that side of the program was extraordinarily important.
Yes.
I agree with that. It gave me an insight into various treatments and ways to approach the subject. I think the conference also showed me basically where people are at on a personal level, how they confront this phenomenon and all the variations that one sees across the society. On a professional level, how people are investigating it, how they're doing research. It points directions as to how far we've gone and what we need to do in the future as well. And it kind of brings it all together in sharp relief, and it's an enormous benefit in that regard.
Just one added thought here. What was so fascinating to me about the role of the abductees at the conference, the scientists and clinicians, therapists, and the investigators, is that in a strange way, each one of us is participating in the world of the other two to a much greater extent than we thought. Even one of the therapists suggested that those of us who were doing this work with people who had these experiences are somehow picking up through just association and osmosis, I guess, some of the same symptoms and anxieties of the people we're actually working with. And I think that nobody can do an investigation without doing de facto therapy.
Yes.
And nobody can do therapy without, in a strange way, with such an unusual subject, being a kind of pioneer investigator. So we're all three, in a strange way, infinitely more interlocked with one another's worlds than we had thought.
How do the therapists feel about this relationship?
I think we're still trying to work on exactly how to define it. I think basically Bud's point is exactly right. Whether I'm working with an abductee or any other kind of problem or syndrome, as a therapist, I am de facto an investigator because it's a dynamic, organic process. I'm learning more about the person and more about his or her biography, and so on. And I think it's true from the other direction. One of the things that we were talking about today, and there was an interesting discussion back and forth, is how does one balance the therapist and the investigator's roles? One person said that there should be a triad. There should be an investigator, a therapist, and an experiencer who, as a team, should move in and deal with each experiencer. Was one suggestion. And I think out of this conference is probably going to come a working group which will work towards a proposal for how to answer these questions in a way that the entire community can accept and debate, so we can introduce it into the public forum, and it can be our community policy.
Yeah, I would just like to interject that it seems, the key in this whole field is the tremendous impact and just feeling that something important has happened that you get when you speak to the abductees. That's where it all starts.
Yes.
But and at previous meetings where there have been abductee panels or presentations, that's what's come across most strongly. But at this one, I had much more the feeling that they were beginning to talk to us and say, some of you people have been too narrow, you haven't opened yourself to this full experience, and as Bud said, I think you're partly a participant in this, not just an observer.
Yes, and they spoke rather strongly about the problem they have in establishing their relationships with both therapists and investigators. Would you like to address that a little bit?
Well, I'd like to actually start off. That's clearly one of the really underlying dichotomies in the people who are looking at the abductees. You have the investigators who are assuming that there is some underlying reality, in many cases, not all of them. And then they're trying to find this out, without distortion, by the emotions of the percipient, which is extremely difficult to do, but they're trying to get through that somehow, get around the confabulation or the misapprehension and so on. Then on the other hand, there's the therapy people who are really trying to change the way that these people look at their experience without particular regard for its origin, and help them come to grips with it, view themselves as survivors rather than victims, or even there were some reports here of going beyond that and changing in a quite global way their perspectives on the whole thing.
See, the problem for John and myself and the therapists who are here is that most of us are working there's a practical problem, most of us are working in regulated professions, and at any time we can be called up to justify our actions as being following the accepted standards and practices of the community. So we're caught in a really difficult situation. On the one hand, we recognize what's going on here. We may not know exactly what it is, but there are people who are isolated and confused, they're in pain, and they need help. We're interested, and we want to do as a public service to step in and try to use what skills we have. On the other hand, all of our training and experience is to recognize a particular syndrome, look at the research that's been done in the medical literature and apply it so that we can go back to our colleagues and our peers and say, oh, this is what we're doing. Maybe the case didn't turn out right, but not all cases will turn out right. At least we did what you believe to be accepted practice, and there are no such standards here, certainly not if I go back to my licensing board. So we have to we walk a very fine line. We want to treat the experiencer with respect. We want to collect information so we can understand what we're dealing with, so we can do a better service to the experiencer without going too far off in the data collection end, without going too far off in our own conceptualization of the phenomena. And that takes a tremendous amount of thinking and discipline and dialogue, and that's what this week was all about.
I think those are extremely important points. Those who have experienced the phenomenon certainly gave us a very clear message about trust, responsibility. Not just any psychologist can pick this up and try to start seeing people. And those who have experienced this phenomenon immediately will recognize that they have a narrow focus, and it immediately can discount very important parts of their experience. So there's a great knowledge that those who are wanting to help need to obtain, and we are constantly, as therapists, gaining in our understanding. It's really a teaching that goes both ways. So I think that these are all very important issues we have to stay, as David said, keep in mind very clearly, very clearly.
But there was one of the professionals who was present who stated rather forcefully that it was absolutely impossible to do both investigation and therapy at the same time. What are some of your views on that?
I'd like to address that.
Okay.
Indeed, we wear many hats, but as it has been already stated, a therapist is a natural data collector just because of the information, the content of the session. Now, as a therapist, I focus on the symptoms, the origin, the treatment, the resolution of that. And in the process, you may hear some pretty strange stuff. And you're not going to discount that, especially if you've already judged the person to be sane. You're naturally going to be collecting data, and you're not going to just pitch it in the waste can, especially with something so bizarre as this. So at one point in the process, you're the therapist, you're really tuning into the emotional needs, but when those have subsided and the person is doing well, then you can deal a lot more with the data side, and you can switch hats. You do not do both at the same time, but you can switch hats in the process.
I think that a lot of the problem here is in defining terms, as it often is in discussions like this. I think when people in this business use the term investigator, they use it in the context of people who've gone out and examined CE1, C2, and CE3 cases. They interview the people and they remain detached, and they take pictures and they collect soil samples. And that's fine. But as therapists, we act as investigators of experience. And that we cannot do that in a completely detached way. And I don't think an investigator who does not call himself a therapist primarily still can't do it in a completely detached way. Most of the people who've been working in this as investigators have found themselves drawn into the support and the therapeutic aspects of what they're doing. So maybe we need a new word, neither investigator nor therapist, but something else.
And I'd like to add one more point, and that is it's hard to wear both hats. So what many of us have already done is included an investigator. Now, instead of thinking that they specifically deal with that part and I specifically deal with the therapy, it's really like just having two heads, two brains working on the problem. And it's really just a teamwork approach.
I'd like to mention one thing that's about the dual roles. Years ago, when I first started looking at these cases, I was using various psychiatrists and psychologists to do the hypnotic regressions. And I was there in the role of taking notes and observing and so forth. But the interesting thing was, as soon as we left, I would leave, of course, with the subject. The subject would be pouring out his or her heart to me about what had gone on. The person would call me at all hours of the night. We would have long discussions. And it dawned on me at some point that in a peculiar way, the person doing the hypnosis, the psychologist, was in a strange way the investigator, and I was doing the therapy. I was the one who was receiving the phone calls and trying to handle the person, and the other person's role, I mean, it was not, of course, as clear-cut as that, but it was a peculiar realization as to who was actually keeping that person afloat and what common sense skills one had to develop to do that. So I agree with everything that's being said here, is that it is extremely difficult to separate these roles.
Yeah, I'd like to also to agree with that. Of course, it's difficult to separate the roles, and it's difficult to do therapy and to do investigation per se as such. I mean, this is a very tough subject, and I think it can be done with a sufficient amount of training. I think that they're complementary, and then I think that my own guess is that a therapist probably would work better knowing exactly what has happened to the individual, so they know what to work with and what to work on. And if you combine these two with a certain amount of insight and compassion and humanity, you'll find out what is happening, and you'll also find out the best ways to approach treatment. But it's not easy, and most people, as David, you say, who are UFO researchers who've gone and investigated CE1s and so forth, this is just not an area that's easy for them to get into. You know, it's very difficult.
I think you can sum this up in terms of compassion, trust, responsibility, and open-mindedness.
In my own personal experience as an alleged investigator, I find it very, very difficult to do classical investigation. I find myself being far more a therapist, a counselor, and I do not feel comfortable with that at all because I'm not trained to do that. Okay, anybody else like to add anything to that? Okay, then, go ahead.
I'd like to add one more thing about that. From time to time, people will send me tapes or transcripts of investigations that have been done, and sometimes they're done by therapists and sometimes they're done by investigators. And I found investigators who do terrific jobs in support, in empathy, and sensitivity, and I found therapists who are very insensitive and very closed-minded about what's happening and not very helpful to people as well.
I think I'm a pretty good empath.
Well, you know, I read recently a review of somebody's book about the abduction phenomenon, and I mean, it was a blurb on the back of the book, and it said that this person is doing the correct thing by and dramatic thing by assuming that these experiences are real to the person to whom they happen, and skipping the question as to whether the events are real event-level occurrences. And of course, I think that that's got everything completely backwards, because everyone would agree the experiences are real to the person to whom they happen. Even the worst skeptic in the world would say it's real to that person. The crucial thing to find out is, did these events occur in the real world? That's what we should be concentrating on, and I don't think that any kind of really proper therapy could even be administered if one was trying to say, for instance, with an alleged rape, that to the therapist it made no difference whether the person was raped or whether the person fantasized the rape. I think the therapies would probably be quite different.
Okay.
The problem is that for people who are licensed therapists, for instance, they're presented with first of all, they're presented with somebody in pain, in distress, suffering post-traumatic stress disorder, some other problem, and they don't know. One group of investigator might have a large number of cases, and they know, and they might go to a conference and they might know. But in my position, if I'm presented with somebody like that, if I proceed on the firm belief that there's actually happened in event-level reality, whether I believe it's true or not, whether it in fact actually is true or not, the end result of that could be that if I have a bad outcome from a case, and all physicians have bad outcomes from cases, no matter how good they are.
And all investigators.
And all investigators, we all do. So, and someone makes a complaint, then I end up having to be called in front of my disciplinary board to justify the fact that I was approaching this case as if this was an actual fact. And that's very difficult to justify to a very conservative medical board. And the end result of that kind of a situation is that I get shut down, probably all the other therapists in town get shut down, it hits the newspapers, and there's this tremendous backlash. So the therapists are in a curious position of wanting to help the best they can and trying to walk this fine line. So I wouldn't be too hard on the therapist for taking that approach.
I wasn't trying to criticize your therapist, but that I think that what's before us is beyond the problem of whether the experiences are real to the people. I think we should all agree that they are.
Some people don't. You see that?
Yes.
Even saying that they're real to the people in a conservative medical or psychological community, that's a stretch.
Well, some people think they're Napoleon, and that's what it is.
But I think you do make a good point, because for us to think that we know all about reality that there is, and then try to describe that to the patient is a very tricky process, because how can we be sure? We have, to some extent, if they seem sane and they have passed psychological testing and they indicate these things are real, we do have to at least consider that. And that is where a lot of therapists do have a problem, because given all that, they still put the boundaries on what they believe and impart that to the patient.
It's very interesting to see when that happens, because they'll be logical. You'll point out to them how logic dictates that they are not psychotic, they're not hallucinating, they don't suffer from organic illness. Therefore, this must be happening at some level of reality, and they'll say, no, they won't go that extra step, even though logic dictates it.
And you see this process with investigation, too, over the years. With each decade that passes, there's a certain chunk of this weirdness that we accept, but there's still this little bit that's too weird yet. And in such an odd field, to call anything weird is something in itself.
Oftentimes this problem, though, is solved by the abductee or the person in front of you many people come and they want to know, did this happen to me, or am I crazy, or did I invent this in some way? But oftentimes what happens is somebody, for instance, I had a situation where I had an attorney who remembered something happened when he was 15 years old, and he remembered the whole sequence of events under investigation. And after it was over, the first words out of his mouth were, "That was real." And there was no doubt in his mind whatsoever, and we just went from there.
But if he was seeing a conventional therapist who wasn't necessarily familiar with this, I've had patients who have done that, and they have left the therapist because the client was sure it was real, and the therapist was sure it was not real. And even though they were working on other issues, that created a crisis of trust, a loss of trust, and they split. It was very traumatic.
The few abductees that I've, followed over a long time, that being just several years, since that's all as long as I've been interested in this, I've talked to some who switched back and forth a couple times. I don't know if you see that.
Oh, absolutely.
They'd start off saying, yes, it must have felt real. They'd walk out of your office and think about it for a couple of weeks, and they'd say, oh, no, that couldn't have been real.
I think that we cannot overestimate the power of denial and the need for denial. That's on the part, I understand the skeptics, I understand all the way down to the abductee himself or herself, the basic need to put this on some shelf. This cannot have happened. And one of the most dramatic things that occurs all the time to me is when there is some bit of evidence or something that the abductee realizes is confirmatory of the truth of their experience. For instance, someone in a couple of cases have drawn exactly the same notational symbols that they've seen inside a ship as my subject did. When the subject was shown the other person's drawing, which I've done twice now, probably incorrectly, that person, both those people burst into tears. They could not handle the fact that what they regard as their last ability to deny had been taken away from them. This is disruptive of the entire fabric of society as we know it, and there is a reason to deny it from every single solitary perspective, especially the perspective of the people who are having these experiences.
Many abductees gave us a very clear message during this conference. They would prefer to be crazy as opposed to having this experience.
All of which brings us back to the importance of a conference like this in informing the therapeutic community of just what might be out there, how to look for it and not misdiagnose it. I can't think of anything more horrifying than some of the stories I've heard about the experience being drugged or even committed because no one recognized what might really be going on.
I want to interject a brief cautionary note here, not that I'm arguing against the reality of this particularly, but one of the things that my eyes certainly were opened up by our organizing this thing together and then hearing the speakers was the fact that there are these other mental, in the case of the ritual abuse, you have a lot of the same kinds of things. You have multiple personality disorders that result from these experiences. You have people drawing pictures that look extremely similar, and then you have a large fraction of the community investigating them, saying that these aren't real experiences. So there are these parallels. I used to think that when you had two independent people who drew the same picture, well, there must be some real cause for that, and now I don't feel that way so strongly.
Why? I don't understand. Why don't you feel so strongly about
Because in the case of the ritual abuse, the pictures shown by different people of, just how they were held down and so on and so forth, and, where the bottle of blood was and stuff like that. They're very similar, those pictures, and yet there are people who argue quite cogently, they were here at the conference, that these experiences did not actually occur. And and then there are the business of some of the people in the ritual abuse groups having shared dreams too. So I don't know. I'm not. It just I don't know how that fits into this, but it is disturbing.
It is disturbing. There is one thing that has to be remembered, though. You can start finding parallels between abductions and a lot of other phenomena. And at a level of abstraction, it'll work quite well. But when you start getting down to looking at it case by case, very carefully, you begin to see certain consistent differences. The shamanic initiation phenomenon has often been cited as a direct parallel. And yes, you can find all kinds of points of similarity, but there are also some very significant differences. And there does seem to be overall in that core abduction phenomenon a coherency that's somehow qualitatively different.
I would also, along the lines you're saying, say that the fact that you often see multiple witnesses to some events that are corroboratory at the beginning of the experience, several people see the UFO and indicate that this one seems to have more power to bring in several people together in a testimonially documented fashion.
Yes. And not just and not just at the beginning. If you take a case like Barney and Betty Hill, they had complementary abductions. Some people have said that Barney picked up Betty's dreams, but then why was his internal experiences complementary to hers and not identical to hers?
One of the important ideas that came out of this for me, a crystallization of an idea, was the idea of clustering, that we may be dealing with a group of clusters of phenomena that, as you say, have certain parallels at a level of abstraction, but when you get past that level of abstraction, they actually separate out into distinct events. But from the point of view of a therapist or an investigator that is seeing somebody cold off the street, they've had an experience that's beyond their conception. They haven't done all the reading into shamanic rituals, satanic ritual abuse, abductions, and a host of other things. So what probably ends up happening is that they identify with the closest parallel that they encounter first, and then they end up presenting to a worker in that field. And it's the responsibility of each worker in those fields that share certain parallels to educate themselves about all the clusters to be able to redirect the person appropriately.
Yeah, I couldn't agree more. And one thing that came out in this conference was that there does seem to be a variety of causes that may have, have similar effects on people. And I don't envy the therapist's position of having to try and sort out as it may be necessary to do in some cases.
Given these various complications that arise, let's talk a little bit more about the team concept of investigation. I assume most of you agree with that general notion. If you don't, feel free to say so. But what would be some of your recommendations for an appropriate investigative team? Anybody?
Well, that's a very difficult question to answer. To answer it generically, I think there should be in a team both psychotherapeutically trained resources, investigative resources, and experiencer resources. So many of the people that I've worked with, one of the first questions that almost always comes up is, can I talk to other people that have had this experience? So these are basic resources that I think should be available. The order in which they're used and the proportion in which they're used is a very difficult question. I think it's part of what we're all still debating.
I can add to that in terms of talking about the integration of those resources. The therapist who's interested in helping may be lacking a great deal in the knowledge of the phenomenon and needs that from the investigator. The investigator is lacking in the understanding of emotional trauma and the sensitivity and timing of such interventions to resolve it, or even what even causes such symptoms. And the experiencer can be there as the support person. Well, actually, everybody ends up being a support person, but at least they have that unique perspective, which the others of us assume we don't have. And you blend those together nicely, with the therapist basically retaining control during hypnosis sessions, but getting information from the others, and then, as Bud mentioned earlier, the others can become support persons. It happens anyway, so you might as well organize it that way.
Well, I was just thinking, one of the situations when it was described that a team should be working with one person, a therapist, investigator, and experiencer, abductee, whatever you want to say. I would have added to that, of course, that's ideally wonderful. We should also have a radiologist.
Right. Good
Someone
point.
with a lot of money and so forth to help with the investigation. The point is that we are spread incredibly thinly. And we are facing a gigantic problem with enormous numbers of people who are crying for help and are very, very confused. We do the best we can with the resources we have, and the very nature of a meeting such as this was this kind of subtext. The idea that we're begging people who attended the conference to put their own bodies on the line and begin to aid in the investigation of this problem. It's almost a luxury to sit around and talk about what would be ideal when what we have now, the resources are so thin, and we're so strained that just if we could triple what we have right now, it would just be a mere beginning.
Well, Bud, it's not only ideal, it's exactly the way I've operated the last 3 years, so it's entirely possible.
Yeah.
I think it's time, and I agree with you on the flood of needs that are coming at us. It's time we train more, because we don't have 100 Bud Hopkins. We need 100 Bud Hopkins, but we need to really bring in people and really start training them.
Exactly.
And then we have to somehow systematize the referral, the training, getting everyone together out there too, and get rid of these big boxes of letters you guys have.
Right.
No, we have to work out a series of protocols so that when a person comes to us and says something might have happened, a whole set of procedures can be set in motion, leading ultimately to treatment, investigation, and everything. And right now, people are just sort of doing it as best they can. Sometimes, in your case, it works out well. For other cases, people just have to do it alone. Some people have some support, some don't. It's a situation that's not ideal, but as Bud says, and as you're saying, essentially, we need to train more people, we need to get more help, and I think that's going to come. I think that almost all the time we have people coming forward, offering to help and offering to do more things, and I'm fairly optimistic about this.
Anybody else?
Well, I don't know how. I think this has some degree of importance in the overall scheme of things. It's a side point to what you mentioned, but you went off probably more important in the immediate direction. I believe myself, at least, to be a non-experiencer. That is, nothing unusual has ever really happened to me. I have a great sympathy for what these people are going through, and yet there is a point beyond which I just cannot really understand, because it's beyond our consensus reality. On the other hand, one of the advantages of that is a certain objectivity, and it's also a kind of groundedness. That is, I encourage people to explore their experiences fully and to come to terms with it, but I'm also, in some ways, kind of a reminder that a lot of their immediate life is still back here in this realm, and I find that in the dynamics that go on in my work, that provides a really nice balance. So I think somehow we also have to integrate that into the overall process.
It's almost as if all of us are adjusting. I mean, we focus on them as making adjustments, but we are making adjustments as well. And it's almost like a grieving process of what we have always known. We have lost that, and we are having to go through the different phases of grieving that and accepting a whole new way of looking at things, which abductees in many cases are well ahead of us.
I think that, just to second what David just said about reminding the people about where their real life lies, part of my whole approach to what I do when I work with people is that very thing, to point out that we spend 99.999 and whatever percent of our life here on this earth, no matter what strange things are happening. And in order to accent that, when I have a support group, the support group meetings are roughly 50% party and 50% discussing issues, because the party aspect of it, to feel that you can be with other people who have the same crazy experiences you've had, and yet those people are interesting and intelligent and fun to talk to, and you can sit around with a glass of wine or a cup of coffee and be a real alive human being in a real live community, where you're accepted, is extremely important. And I don't ever try to focus the support group thing in terms of just even maximum amount of time onto the UFO subject. I think that this groundedness is one of the most important therapeutic things we can do. It doesn't take a therapist to help somebody have a nice time in the real world with some companions who you can come to love and respect, who've had your experiences.
Okay. Let's talk a little while now about what's next on the agenda. Where do we go from here? What's the state of the art? And in that same context, suppose there are people watching this who may be experiencers. If anybody has any recommendations on for them.
May I just
Sure.
interject something a little bit ahead of that?
Okay.
Because I wanted to discuss what to me was one of the important outcomes or realizations, I think, of many people at the conference, and that, which also has its antidote, and that is that, it seems from the Roper poll that a lot of people have symptoms that are associated in the reverse direction with being an experiencer, and there are a couple of studies with very low statistics presented that indicate that these may be used as questions. Some of the questions, like the ones in the Roper poll, may be in fact used to pull out people who are experiencers. And this, on the one hand, indicates that the fraction of experiencers in the general population is tremendously high, maybe in the low percent level. And now that cuts both ways. The first way it cuts is, it means that the sample of people we've gotten are only 1,000th, the tip of the tip of the tip of the iceberg, and so the way that we've selected them inadvertently, or the way they've selected themselves, is a tremendous possible source of bias on what's really out there. On the other hand, the fact that this is such a prevalent, seems to be such a prevalent thing in the general population means that we can select people in a very unbiased way. We can go out and search them out. For instance, the people who responded with 4 or 5 positives in the Roper poll, and I think it's clear that these people should be followed up, and that they will be followed up, even given the tremendous overload that we have among the investigators and therapists in this.
But given that they often do this on their own timetable, how is that going to affect things if you go out and start trying to push them into the other?
No, you have to wait until they see or feel a need to explore it.
Right.
They may have these symptoms, but they may not want to do anything about
That's
it.
right.
Oh, certainly not.
Yeah.
But a number of them indicated in the poll that they're willing to be followed up, so you can
That's
follow
right.
up and
Yeah,
explore
sure.
this issue.
Okay, yeah.
I would share your view that you shouldn't push anyone into therapy or investigation who doesn't.
Yeah.
I certainly agree with that. I think that the next thing that has to be done, however, and one of the more important ideas that I've gotten from the conference is that we must have a standardization in methodology and in treatment that is agreed upon by most people who do this sort of work. I think that this is extremely important so that we can learn what the parameters of this phenomenon are, and also so that we can learn the proper modes of treatment. I think this is coming, but right now we still have an awful lot of work to do with that. And of course we also need, as we mentioned before, we need to simply enlist more people in doing this, and the Roper poll study has shown that there's an awful lot of therapists out there who are willing to donate their time and to at least to look into it further, and we hope that we'll be able to get a significant number of them who will actually engage in this kind of work, and so we're quite optimistic about that part.
One of the aspects of the conference which suggested a bit of a problem to me is there seemed to be a tendency from time to time to slip into discussions of the nature of the aliens, quote unquote, whatever they may be, as to whether they're helping us or hurting us.
The good guys versus bad
the
guys.
good guys versus the bad guys and so forth. And of course, I think essentially that gets into almost a kind of theological argument. And I think we must concentrate our attention on what is happening to human beings and help them explore their own personal experiences. Because I think if you start dealing with whether or not you have been, these are enemies, these are friends, or whatever, you're providing yourself with either food for paranoia or some kind of rationalizations that can feed a certain kind of denial. We've got to get people, I think, away from those judgments,
But
one way or the other.
what happens when it's the experiencers who make that judgment, though?
No.
We see that happening.
I think that one of the problems is that the investigator or therapist involved can have an undue influence in that area, and I think we've seen examples at the conference, I have, of feeding a certain sort of theological line being paid out by therapist, investigator, or whatnot, which I think is not, in other words, it's almost as if they're trying to decide the nature and moral qualities of the germs without trying to figure out what the disease is.
This is a very complex question because it turns back to the question of investigator versus therapist, depending on how you want to define those terms, and the balance between when do you have enough information versus, which is what the investigator wants. The investigator wants complete information, and the therapist's primary goal is to return the patient to a state of emotional stability. And if one is working a case through to a certain point and psychologically there appears to be a calm and a resolution, but one may not have a full corpus of data, then what do you do? Now, as a therapist, my primary obligation is to maintain their health. It is conceivable that we have not worked through the full body of material, but perhaps we have reached a plateau for that person at that time. To force it through, that's a difficult decision, and most of the time, actually, I don't do it because I still know with certainty so little about it, but they know that I'm available for them, whether it's in a month or 6 months or a year, I'm still there.
Right.
So I don't really care how long the investigation takes.
I agree, David. I don't think anybody wants to force somebody through to anything. I mean,
And I'm
we
not
don't even have
implying
the time
that.
to think about that. I know. We don't have the time for that. But I think that that the biggest cloud on the horizon, actually, as I see it, is a kind of theological argument, which is, I think, essentially a waste of time.
Yeah.
It misses the point all the way around.
But that's the way the experiencers, or certain ones of them, seem to be taking it. To them, it's beginning to be a profound philosophical or religious issue. So they are introducing
Well,
her.
perhaps that's a method of their coping, though.
Yeah.
And if
Yeah, I
they
suspect
choose
so.
that and it works for them and it doesn't hurt them or anybody
Yeah.
else, it's okay.
No, I agree with that. I completely agree with that.
You know, I want to ask a question here about Dave, really. One of the things that I've observed in the difference between investigators and therapists, or I don't want to paint it that black, between those two different logical systems, is the difference in what is perceived as progress or truth. To the investigator, it's case-to-case reproducibility, and to the therapist, many times it seems to be a big change in how the person relates to the phenomenon. Now, in your work, do you feel that lines of investigation or approach, to a more neutral word, that result in significant change in how the person views the experience, would you regard that as something to be encouraged or stay away from, or a positive indicator that you're on the right track, or do you think this indication you're beginning to mislead these people in religious ways?
Well, I don't try to lead them into any view of the nature of the experience. We just try to uncover what actually happened.
Right.
I don't care what to do, and when I have a support group meeting, one of the things I have to do is, to some extent, referee between people who want to break the necks of the aliens and other people who feel they've had some kind of spiritual growth as a result. And it's fine by me. I don't care which ones, but the point is, it's an argument that leads nowhere, and we want resolution. But of course, I'm feeling very often that people who have come to a very, very positive view of the experience have just, in a certain sense, constructed a silver lining, which is perhaps postponing the true effect of the disillusionment that's bound to come, and the problems and so on. So I see it as, in a certain sense, a problem of therapy.
That's right. I think what you're saying, and what I find also, is that to me, however the abductee handles it is up to the circumstances and the background and the upbringing of the abductee, and whatever works for them is the best way, and we'll work with that as long as it brings relief and some sort of therapeutic value. The danger is having the therapist or the investigator have a structure of his or her own that they overlay on the experience and sort of steer the abductee into that structure, and that has a totally different agenda, and that can be quite dangerous, I think.
A very
Don't
quick,
try to steer them away from it.
yeah. Oh, you're right. A very quick example of something I was horrified was one man who was a therapist who insisted that aliens were much more trustworthy than human beings, and that one of his ritual things he tells a new abductee he was working with, or experiencer, whatever, is that he has to fill them in on the government cover-up and the extent at which the government is lying. And I thought, how in the world would any therapist have the nerve to say that's something he has to present to his patient or his client? I mean, that's again almost theology.
That kind of a problem is offensive, but it's not unique to this phenomenon. It comes up in all kinds of therapeutic cases, and it's bad work. And the problem is that it's hard to find good people, like it's hard to find a good pizza in town. But it's a problem, damn it, that we all face.
Exactly.
Well, from the standpoint of a data shuffler, the completeness of any one given case is not all that significant if you have enough cases. The overall body of the thing, it'll all equal out in the end if there is genuinely some kind of equality in there. So, by all means, I would say look out first and only for the good of the
Absolutely.
person.
Yes.
And
The data will take care of itself, as long as everybody communicates that data.
Cooperates, yes.
That's an excellent point. For the duty, I think, to whoever is doing the research, whether it's research or investigation therapy, is for the client or the patient in front of them, and their well-being is number one on the priority list, and collection of data is number two, and number two is at a much lower level.
I had an example of working with a 13 or 14-year-old girl who was a born-again Christian, who was in tears and shock after an abduction, which she remembered consciously, because when she was on the table and things were being done to her body, she was praying to God to save her, take her out of there. And God didn't save her and take her out. And I found myself having a long, long discussion about why that should not be damaging to her faith, because I was certain that there were other times she'd prayed for some sort of deliverance that prayers, one reason or another, had not answered. And here I was, from the point of view of someone fairly agnostic,
And now you're the
doing what I
theologian.
could to help this young woman get back the support that seemed to be very crucial to her life and which she needed at that point. So I think we do have to use every possible tool that's available to help that person, regardless of data or.
Okay, good. That's a very good note to close on, and I want to thank you all very much for your cooperation. Thank you.
Just add one thing, and that is that one of the big problems in this field is resources.
Yes.
We're beginning to get people who volunteer to collect up a number of MRI or CAT scans, or who are going to deal with alien writing or something like this. I mean, we're beginning to get into the specialist regime. But all of this kind of thing, and the investigation of physical evidence in particular, but data banks and standardized psychological testing forms requires money. And I really think that the people out there have got to start supporting the fund for UFO research with a little bit more than $25 or $50. I mean, some serious resources are needed in this field, and progress is clearly being held back because they aren't there.
That's even a better note to close on. Thank you.